where are incisions placed for breast augmentation? When it comes to breast augmentation, the placement of incisions is a key factor that affects both the outcome and recovery. Surgeons aim to choose locations that minimize visible scarring while ensuring effective implant placement. Let's explore the most common incision types used in this procedure. The inframammary incision, often referred to as the breast fold incision, is the most frequently used method. It is located in the natural crease beneath the breast. This incision accounts for about 70 to 80% of breast augmentations. One of the main advantages of this approach is that it provides excellent visibility and control for the surgeon. This allows for precise placement of the implant, whether above or below the chest muscle. The scar is usually well hidden under the breast or by clothing, making it less noticeable. Additionally, this method avoids cutting through breast tissue and milk ducts, which helps reduce the risk of complications related to breastfeeding and changes in nipple sensation. It is also beneficial for women who may need revision surgeries in the future, as the same incision can be used again. Another option is the periareolar incision, which is made around the edge of the areola, the darker skin surrounding the nipple. This incision can be a full circle or a semicircle on the lower half. The scar tends to blend well with the areola's color and texture, often making it nearly invisible once healed. This method allows for precise implant positioning and can be useful for future breast surgeries. However, it does involve cutting through breast tissue and milk ducts, which may increase the risk of breastfeeding difficulties and changes in nipple sensation. It is generally not recommended for women with very small areolas due to limited access. The transaxillary incision is made in the natural crease of the armpit. This technique avoids any scars on the breast itself, which is appealing to many patients. Implants are inserted through this incision, often with the help of an endoscope, a small camera that assists the surgeon. While this method avoids breast scarring, it can make achieving symmetrical implant placement more challenging. Additionally, future revisions may requiring additional incisions on the breast, and scars in the armpit may be visible depending on arm positions or clothing. This technique is used in about 10% of cases. Lastly, there is the transumbilical incision, also known as the belly button incision. This less common technique involves making an incision inside the belly button. Saline implants are inserted and filled once in place. This approach leaves no visible scars on the breast or armpit but is technically more challenging and not widely used. In summary, the inframammary incision is the most popular choice due to its direct access and minimal impact on breastfeeding. The periareolar incision offers good cosmetic concealment but carries higher risks related to breast tissue disruption. The transaxillary incision avoids breast scars but may complicate implant positioning. The transumbilical method is rare and limited to saline implants. Ultimately, the choice of incision depends on individual anatomy, the type of implant, the surgeon's experience, and patient preferences. Consulting with a board-certified plastic surgeon is essential to determine the best approach for achieving desired aesthetic outcomes while preserving breast function.